I was a smoker myself. My late father was a smoker. He died as a smoker.
Nous sommes au stade premier de l'épidémie du tabagisme parce que de plus en plus, on trouve beaucoup d'Africains qui consomment régulièrement les produits du tabac sous toutes ses formes.
Le rythme auquel le tabagisme se répand en Afrique est, je dirais, effrayant.
The African Tobacco Situation Analysis launched in 2007 in 12 countries across the continent, from Senegal in the west to Mauritius in the east. The project attempted to understand the critical determinants of success for tobacco control in Africa to inform the development of and support two tobacco control strategies, including national legislation, fiscal and smoke-free policies. The project had two main approaches. First, multidisciplinary teams in each country use political mapping techniques to identify and understand key domestic stakeholders and the relationships among them. And then, building on this political mapping process, each team developed country-specific priority interventions in tobacco control.
ATSA is the Africa Tobacco Situational Analysis Project. It's actually to identify the status of tobacco control on the continent, but it's actually moved beyond mere research into certain concrete action. It moved so fast that we were able to identify status and intervention, and in that process we were even able to achieve policy change.
Le but de l'analyse situationnelle au départ, c'était de voir les déterminants critiques de l'utilisation de la lutte anti-tabac en Afrique.
ATSA was divided into two. The first phase is that let's collect the information that we know. Then after getting the information, then knowing exactly what to do about the information.
Step 1. Political mapping. During this phase of the project, the ATSA team sought to understand the power and interest of different stakeholders, from tobacco control advocates on one end of the spectrum to the tobacco industry on the other. This process helped each team to identify critical challenges and opportunities, relationships, policy priorities, and possible interventions.
Dans le cadre du projet ATSA, nous avons tenu à procéder à une cartographie des acteurs. Nous avons voulu savoir quels sont les différents types d'acteurs que nous rencontrerons.
Who has the most power in terms of policy influence? Who has the most power and who should we be targeting, and what strategies we should be using for each and every one of those people?
Si l'on connaît la position, les forces et les grands leaders qu'il y a dans ce milieu, ça permet de mieux naviguer, de savoir qui on peut coopter, qui on va avoir contre nous, qui il faut travailler pour l'avoir avec nous.
What we wanted is to try and see those who had a lot of power when it came to issues to do with tobacco. But at the same time wanted to know those who had a lot of interest in tobacco control. Ultimately to try and get those who had a lot of interest and also a lot of power, who we could work with. So we put them in those quadrants, and then we ranked them up to try and see who were the most appropriate people to deal with.
We chiefly involve the political office holders, especially people in the House and the people in the executive arm, and we had sessions with them where we could actually educate them and address their questions.
And I tell you, in Africa, one single individual in a very critical government position that you can win over can actually change the equation in certain countries, and that was why that political mapping was very important.
Step 2. Country interventions. Based on the political mapping process, each ATSA team developed context and country-specific interventions. For many countries, this included a mix of smoke-free pilot projects, the creation or revision of national tobacco control legislation, and specific actions to monitor and enforce that legislation. In Senegal, the ATSA team focused on developing new national legislation in line with the World Health Organization's Framework Convention on Tobacco Control. This convention contains legally binding provisions including price and tax measures to reduce the demand for tobacco, protection from exposure to tobacco smoke, regulation of tobacco packaging and labeling, banning tobacco advertising, promotion and sponsorship, and protecting public health policies from the influence of the tobacco industry. In Kenya, the ATSA team developed new monitoring and enforcement tools to measure the country's actual progress in tobacco control. The Mauritian team evaluated the effectiveness of graphic health warnings on cigarette packs and supported government cessation programs. And perhaps most prominently, the ATSA team in South Africa successfully advocated for a smoke-free 2010 World Cup.
On avait trouvé que beaucoup de gouvernements avaient ratifié la convention cadre, mais l'application de la mise en œuvre de la convention cadre n'existait pratiquement pas. Il n'y avait pas de loi anti-tabac dans les différents pays. Et donc, en définitive, le projet s'est approprié cette situation et a essayé de choisir une ou deux priorités dans chaque pays.
Pendant très longtemps, on a parlé de lutte contre le tabagisme sans mettre en place des activités concrètes. Alors, avec le projet ASTA, on a défini une priorité qui consistait à renforcer le processus d'adoption d'une nouvelle législation. Alors ça, on a fait un véritable pas de géant.
What we did in the ATSA project was to build capacity of organizations that are working on the ground to do ground monitoring. We actually do two levels of monitoring. We did media monitoring, which was basically to track any reporting on tobacco control issues. And we also did ground monitoring, where we trained some NGOs that are working on the ground. We developed a monitoring tool, and using this tool, people went around and collected information on the level of enforcement or implementation of the act.
La priorité qui était retenue pour nous ici au Cameroun, c'était de mettre en œuvre les lieux de travail, espaces publics sans fumée dans la ville de Yaoundé.
Ce projet nous a permis quand même de sillonner la ville de Yaoundé et de sensibiliser au niveau des communes, de sensibiliser même les bars, les restaurants qui sont vraiment des milieux assez hostiles. Et nous avons eu des résultats positifs.
And there must be no smoking in public places, and the public places we have defined as enclosed areas.
If anybody is coming into the hospital premises, once he sees that sign, or it's just a question of pointing to the sign, look, you don't have to smoke here. And since then, it's been working.
So the work we're doing here could actually serve as a catalyst for the national process, where the policymakers see that this can work, and because it's working in one of the states and it's improving public health.
Through the political mapping process and lessons from the implementation of specific country priorities, ATSA teams have identified important future directions. This includes strengthening the use of local evidence for tobacco control policy through greater collaboration between advocates and researchers, engaging decision makers in the pursuit of intersectoral action, and further studying the social and economic dimensions of tobacco control, including taxation and the impact of tobacco use and production on livelihoods and communities. ATSA has also contributed to the development of two prominent networks in tobacco control: the African Tobacco Control Alliance, or ATCA, and the African Tobacco Control Regional Initiative, or ATCRI.
We have been able to mobilize more people into tobacco control, because for each country we have to build, a pool of people that includes researchers, academics, government people, and civil society to work together on tobacco control.
Now, for anyone who wants to do tobacco control, we have a starting point. We know exactly what our priorities are, and we know exactly who to engage through the stakeholder analysis that we did at that particular time. So in a lot of ways, I think ATSA was a very, very big blessing to tobacco control in Zambia.
Le projet ATSA a permis au Sénégal d'enclencher une vraie dynamique dans la lutte contre le tabac, en mobilisant des acteurs qui avant ne travaillaient pas ensemble.
It was timely for the country. And we had the opportunity to evaluate all those policies that had been introduced, and also to make changes in what we think can be improved.
Après 2 ans, ce que nous pouvons dire, c'est qu'il y a une avancée sérieuse dans l'élaboration des lois anti-tabac.
Le projet ATSA a été quelque chose de formidable au Sénégal. Ça nous a permis véritablement de replonger de plein pied dans la lutte contre le tabagisme.